Now looking at the muscles of the leg, here we've got an anterior view of a left lower limb, but we're just looking below the knee here at the leg. So here's the anterior compartment, but we can see here the medial surface of the tibia. So just lateral to that is the tibialis anterior muscle. And you can see the tendon coming down here to attach into the medial arch of the foot. Then next to that, just lateral to it, we have the extensor digitorum longus, but the tendon of the extensor hallucis longus comes out between the two. So between tibialis anterior and digitorum longus, we have the tendon of extensor hallucis longus, and we can see that coming along to the end of the big toe, the first digit. So the muscle belly for extensor hallucis longus is just deep to the digitorum longus and the tibialis anterior, and which means on the specimens it's going to be difficult to spot unless you move extensor digitorum longus aside, and on the model it's actually on the posterior aspect here. You have to pull extensor digitorum longus out to find the muscle belly of extensor hallucis longus. Then, just lateral to that, we have the fibularis muscles. Now, in between, though, there should be an anterior intermuscular septum. Now, that's not on this model, but on the specimens, you should be able to find some connective tissue in here between extensor digitorum longus and the fibularis longus and brevis here. But there's a bit more, there's one more muscle in the anterior compartment, and the muscle belly is sometimes kind of impossible to distinguish from extensor digitorum longus. And that's, the muscle is fibularis tertius and the tendon is here. So on the dorsal aspect of the foot we can find tibialis anterior tendon, then extensor hallucis longus, and then there should be 4 extensor digitorum longus tendons coming down to attach to digits 2, 3, 4 and 5. And the next tendon here coming to the 5th metatarsal will be fibularis tertius. Now, so that's where I can easily pin it, where you can clearly make out the tendon, but the muscle belly will be part of, on this model certainly, extensor digitorum longus. It's usually just this distal part here. Sometimes on a specimen there's a very clear dividing line here, and you can confidently say, well, that's fibularis tertius and that's extensor digitorum longus, but not always, okay? So for me to pin it and be sure that you know what I'm asking, I'm likely to pin the tendon. Now remember, not everyone has one, but it's only about 5% of people, or 4 to 5% of people don't have one. All right, so onto the lateral compartment now. So here we've got fibularis longus here firstly, the more proximal muscle belly, and there's actually a line just here where the fibularis longus muscle belly ends. So that's fibularis longus, and there's another line here where it ends posteriorly. So that's where it ends there. So this is fibularis longus muscle belly. This is the tendon. This is the one that disappears under the foot. So this tendon goes under the plantar surface of the foot here and over to the medial longitudinal arch of the foot. So that's fibularis longus. Then fibularis brevis is this muscle tissue here anteriorly and here posteriorly. And then it's this tendon here that attaches into the 5th metatarsal, very close to where fibularis tertius attaches as well. So this is brevis, and then this is longus. And then, in between fibularis longus and brevis and the muscles of the posterior compartment, which here we're seeing soleus, there's the posterior intermuscular septum. So again, there'll be connective tissue in this gap here, and if you can find that, that's the posterior intermuscular septum. Now, it's not on this model, but it will be on some of the specimens. And now the posterior compartment. So here, from a posterior point of view, we can clearly see 2 heads of gastrocnemius. Okay, we've got a lateral head here and then a medial head. We can see a bit of soleus here, either side of the aponeurosis of gastrocnemius. If we remove the medial head of the gastrocnemius, we can see soleus more clearly under here. And then there's a tendon. That tendon is plantaris. And if we look at the lateral head of the gastroc, This most proximal part of it is plantaris. So plantaris masquerades or pretends to be that most proximal part of the lateral head of the gastrocnemius muscle, but then the tendon actually attaches medially on the calcaneus. So the tendon travels medially and then attaches just on the medial side of where the calcaneal tendon attaches to the calcaneus. So this is the calcaneal tendon here that the gastrocnemius and soleus both attach into, and the little plantaris tendon will come down and attach just medial to it. Now if we remove the gastrocnemius and soleus completely, we've got the four deep muscles of the posterior compartment. And firstly, at the proximal end, here's popliteus. So it's this small muscle here attaching over to the lateral aspect there of the femur. Then we've got three deep muscles here in the middle, tibialis posterior. On the medial side, flexor digitorum longus. On the lateral side, flexor hallucis longus. Remember, those two cross over. So this one is going to go to the big toe, this one the lateral 4 digits. Okay, so they cross over under the foot. But tibialis posterior doesn't stay in the middle either. Okay, so when we come down to just behind the medial malleolus, please remember that here we're looking at the first tendon we come across, the most medial, is tibialis posterior. Then we have flexor digitorum longus, then flexor hallucis longus after we've looked at the neurovascular bundle there too. So remember that there's a bit of crossing over. Tibialis posterior muscle belly is in the middle, but the tendon, when you get down to the malleolus, is the most medial. Now there would be a flexor retinaculum covering these muscles here, but it's not shown on this model. But if you do find connective tissue on a specimen here, that's the flexor retinaculum. Now there's only one flexor retinaculum, but if we then look at the extensor tendons here on the dorsal surface of the foot, here we can see a retinaculum, and it's kind of, if we look at the medial view of it, the medial aspect, there's two bits to it, so it's kind of Y-shaped. This is the inferior extensor retinaculum. Now that means that there is a superior one, and it would be just about here. And it just runs straight across. There's not two bits to it, it just runs straight across, but it's not shown on this model. It will be on some of the specimens, but not necessarily all of them. So that would be superior extensor retinaculum, and then the Y-shaped inferior extensor retinaculum there. And then if we look at a lateral point of view, where we're looking at fibularis longus and brevis again, we can see two retinacula here. This one here, coming from the lateral malleolus over to the calcaneus, is the superior fibula retinaculum. And this one here, that's a continuation of the inferior extensor retinaculum, once it gets to the fibularis brevis tendon there, then that becomes the inferior fibula retinaculum. So it looks like it's just a continuation of the inferior extensor retinaculum, but this bit here is inferior fibula.